Hello listener, I am going to talk about blood supply of cerebral. There is 5 points that I want to talk about. First, carotid system. Second, vertebral basilar system. Third, the circle of Willis. Fourth, arterial disorders, and the fifth one, cerebral venous drainage. Carotid system. It is composed of internal carotid artery and its branch, which is anterior cerebral artery and medial cerebral artery. Anterior cerebral artery. It supplies orbital and medial surface of the frontal and parietal lobes, a narrow part on the superolateral surface. Medial cerebral artery. It supplies entire superolateral surface, which is somatosensory cortex, motor cortex, language areas, which is Broca's area and Wernicke's area, auditory areas, which is primary auditory area and auditory associations, or the other name is H. gyros. Vertebral basilar systems. Its two vertebral arteries unite to form basilar arteries, and it divides at the upper border of the pons into two posterior cerebral arteries. Posterior cerebral arteries. It supplies anterior and inferior parts of temporal lobes, uncus, inferior temporal gyrus, and inferior and medial part of occipital lobes, which is visual areas. The circle of Willis. It joins the carotid and vertebral basilar systems. It located on the base of the brain, and it encircles optic chiasma, hypothalamus, pituitary gland, and midbrain. The arterial disorders which can occur. First, stroke. It is sudden occlusions of the blood supply. It can be hemorrhagic or ischemic. The second is aneurysm, and the third one is an angioma. Cortical veins. It is cerebral venous drainage, which included superficial and deep veins. Superficial cortical veins divided into three parts. First, superior cerebral veins. Second, inferior cerebral veins. And the third one is superficial medial cerebral. Deep cerebral veins. It drains the internal structures, which is basal ganglia, internal capsule, and thalamus. They merge to form two internal cerebral veins. The two veins unite in the midline to form the great cerebral vein. This short vessel joins the inferior sagittal sinus to form the stratus. Thank you for listening. Goodbye.